Hello, everyone, and welcome to Connecting the Dots with Dr. Ashaye, a great place to be if you desire to take charge of your health so you can live fully while enjoying doing what you love. So today I'm here with a very special guest, Dr. Arinola Dada. She's board certified in rheumatology and clinical densitometry. Her passion is to help people with autoimmune diseases get their immune system back on track and to help people dealing with joint pain become pain-free so they can live active lives. And today we're going to be discussing gout, the best way to treat gout and what you should do, what you should know to stop the pain. Welcome, Dr. Dada.
Thank you so much, Dr. Ashaye. I'm so happy to be on your podcast. I was telling you earlier, I've been binging the last 1 week on your content, and I've learned a lot, right? So especially the part about sleep, I was like, please, you're talking to me. So thank you for your hard work and what you do. It makes a difference.
Thank you. Thank you. I really appreciate that. And thank you for being here. So before we get into it, you're listening to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a double board certified family and lifestyle medicine doctor and owner of InTouch Primary Care, a membership clinic in Sugar Land, Texas. And I am so excited you're here. If you're seeking a much more convenient and proactive approach to your healthcare, come and join us. You can enroll at www.intouchprimarycare.com. And remember, you can listen to this episode and all our other episodes on the InTouch Primary Care YouTube channel. Leave comments, subscribe, and please share with someone that might need it. You never know, it could make a huge difference for them. All right, so let's get started, Dr. Dada. So what would you like to share about yourself personally and or professionally?
I've been a rheumatologist for 20 years, but I think one thing that I really enjoyed when we first met, we met about a year ago, I think, on a bus at a conference, and we're sitting at the back. And I was just so enthralled with your passion for prevention of diseases, right? And I think that I found that we aligned a lot. That's why I was so excited to come to your show, because I really believe in prevention. And so prevention comes from even the food we eat, exercising. And so I'm a strong believer in that. Let's make sure we're minimizing processed foods in the body and that we're actively exercising. So I've been exercising for years. I'm not a marathoner. I do a little bit. I do my own little bit. I start from where I am, but I've always gone for walks, done the little treadmill, done things like that. So strong believer, I think, just like you, Dr. Ashaye, in doing what we can do to keep healthy, because we're all living for longer. Right. So I'm a strong believer in that. And that's one of the reasons why I decided to come to your show, because I think we share similarities in what can we do to prevent diseases, both for our patients and for ourselves.
Absolutely. Yes. Preventative care is huge. It really makes a difference. So yes, I remember that conversation. I really, really enjoyed it too. Awesome. So, okay, you're a rheumatologist, you have a thriving practice. What kinds of patients do you see?
So we see primarily people who have autoimmune disease, and that's kind of when the immune system is out of whack. The immune system is really supposed to protect us from enemies, both foreign and domestic. Foreign enemies are things like infections, and domestic are like cancer. And something has gone terribly wrong, and then one develops an autoimmune disease. So to answer the question, we treat people with rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, lupus, and one of those are like immune system issues. We also treat people with joint pain from like osteoarthritis, when there's wear and tear in the body. And specifically, we also treat people who have osteoporosis, when the bones are like thin and fragile.
Right. Great. So let's get into gout. We're saving that one. So what is it and why is it important to address?
I was talking to someone the other day, and I kind of used a phrase called, oh, he got the gout. It doesn't sound pleasant, and that's exactly what it is, right? There are famous people in history that got gout, like Henry VIII got gout, and his description was like somebody took a hammer and smashed his toe, and they come back a week later and smash it again. That is kind of the visual of gout. So one of the reasons you want to treat it, it's painful and it damages the joints. But why do we get it? The people get gout because the kidneys are not able to excrete the uric acid, which is a byproduct of protein. We are protein, we're muscle, right? So we are protein, our body turns over, we eat protein, right? And sometimes the kidney, it's like a super function. It doesn't mean that your kidneys are in trouble, but it's a special function, and that tends to be genetically determined. So a lot of people that have gout typically runs in their family. So back way in like the prehistoric times when we were running around, we didn't have a lot of protein, and we were like, maybe one-fifth our current size. So we were able then to excrete uric acid, and we didn't really have to have any special powers. But over the time, over years, or centuries, right, we now have surplus. So gout was described as a disease of kings, and I guess we're all living in surplus times now. And so our diet has changed, and we're not able to really excrete this uric acid as we should. So it ends up building up in joints. And so when it builds up in joints, the body is like, what is that? And then it causes this acute attack. And so that's when people feel like, oh, my foot it feels like somebody hit it with a hammer.
Ouch. Yeah, doesn't sound pleasant at all. And you're right. That's how most people with gout present, like just this, they call you right away. It's not one of those conditions that that people wait for because it's so
people tend not to want to sit on that one.
Yes, exactly. Okay, so someone with gout may be listening. What are 3 practical tips that they should know to help them prevent or stop the pain quickly?
So when you have a gout attack, like I said, it feels like you can't even bear the sheets on it, right? You don't want anybody even touching your toe. But there is a prodrome. There is a time when you're like, I think my gout attack is coming. That time, before all hell breaks loose, that is the time to take action. So, you have to talk to your doctor, but anti-inflammatory medications, over-the-counter, Advil, Aleve, are things that can quickly nip it in the bud. Like it's like at the beginning when you're like, what happened to my toe? I'm thinking about my toe. That is the time. So you elevate, you hydrate, and you can use over-the-counter anti-inflammatory medications. By the time you have a full-blown attack, when you can't walk and you have to take off your shoe and walk into your doctor's office with a shoe in your hand, you need to see your primary. You need to see your doctor, and it can be treated, right? It's just that people may not be aware that it's like a fire. You can treat it really quickly with your little fire extinguisher, or you can get to where you have to call the fire brigade, right? So treating it early and quickly is probably the best way to treat the acute attack.
Yeah, that's great. I love that analogy. I mean, it's actually the same for health in general, actually, right? Yes. When we talk about preventative care, you can control it if you do the things you need to do early on. But if you wait, then that's when we get into, it just becomes very difficult to manage. So, or it's manageable. It's just more. It takes more for sure.
More. You need more. Yeah.
Yes. Great. Thank you. So can you tell me a story about how a patient with gout was able to prevent or reverse their symptoms?
Yeah, so I actually have a good one. So I was in the nail salon, minding my own business, getting my nails done. This is, I think, just after the pandemic went, well, I guess pandemic's kind of iffy. But anyway, when we're out there and able to get our nails, so I was getting my nails done. And then the manager walked across. And I was like, what's wrong with you? Because he was limping. And he's like, oh, it's my gout. And I was like, okay, well, let me see that. Let me see that. So he brings his foot and I'm looking at it and it's swollen, it's red, it's inflamed. I'm like, who's your doctor? And he mentioned it. I was like, I know your doctor. Okay. I made a note. I said, okay, this is what you should tell your doctor that you need to do. So I gave it to him and his doctor promptly texts me and says, can you see him tomorrow? I'm like, fine, And so we talked about diet, what are the things that he could do to even prevent the attacks? So he loved shellfish and weekends he likes to drink beer with his, I'm like, no, you can't eat shellfish. You have to break the addiction to shellfish, break the addiction to beer and organ meats. He's like, I love the innards. I'm like, please stop. So you can't have the innards, you can't have the shellfish, and you can't have the beer. Those are the 3 rules, right? If you have gout. So we talked about diet. we also gave him a plan to prevent future attacks, right? And then we also kind of gave him an out that, hey, if everything fails, let's talk about a specific personalized plan for you that is going to help to protect your joints, because all those gout attacks can cause damage to the joints, right? So, I mean, he's done well. He's broken his addiction to shellfish, innards, and there, and so he's actually done pretty well. And anytime I see him, he's not limping back and forth on the floor of the salon. So.
Yeah, wow, that's a great story. Isn't that amazing? Like you were right there at the right time. I'm sure he's very happy about that.
It was funny when he said it's my gout. I'm like, I'm a rheumatologist. Like,
yeah,
you can't be limping around in front of a rheumatologist.
That's great. That's awesome. Yeah, it's and it's really a lifestyle thing for him. Like, the fact that now he can just work to the best of his ability. He's probably more productive. He's not in pain. So many things that come out of that.
It's grouchy too. You're not happy when you're in pain.
Yes, not at all. Not at all. Okay, so we have come to the end, and I just wanted to find out, do you have anything else you want to share with us, with our listeners today?
I think a lot of people get a little overwhelmed when we start talking about, if you're overweight, for instance, and we start talking about weight loss, it starts to become overwhelming when you start talking about exercise. And I think what my guiding principle is for my patients, just start from where you are, right? I'm somebody, for instance, who likes to drink soda. I would say, okay, why don't we switch it to water? Like, just start. You don't have to do everything at once. Don't get overwhelmed. I haven't exercised in a while. Then, park your car furthest from the grocery store and walk in, right? Just start from where you are. Don't get overwhelmed. It is a marathon, not a sprint, right? So it's a gradual process of getting healthier. And I think that if we can all embrace it, I think we're going to have a better quality of life over time.
Yes, thank you. Thank you for sharing that. Yes, because it is sometimes discouraging or overwhelming, but I think that's a great principle that you share. Just start from where you are. So thank you so much for sharing that. How can people find you?
Well, yes. So we help people with autoimmune diseases and joint pain get their immune system back on track and become pain-free. If you are in the greater Seattle area, you can look us up at overlakearthritis.com. You can follow us on our YouTube channel, Healthy Joints, Healthy Lifestyle. You can also look at our handle at Healthy Joints, Healthy Lifestyle on Instagram. And reach out and we will be happy to work with you towards a healthier version of yourself.
Great. Yes. So please go check her out if you're in the Seattle area. If you have autoimmune conditions or any of the conditions that we talked about, osteoporosis, gout, we just talked about, there's so many things that you can be helped with. And Dr. Dada has a wonderful practice over there. So you really, really want to go check it out. Thank you for listening. And please remember, subscribe, share with someone that may need it. And if you are in the Houston area and you want to experience the peace of mind that comes with being able to reach your doctor when you need it, check out our concierge-like practice, InTouch Primary Care. You can enroll on our website, www.intouchprimarycare.com. Thank you for listening, and I'll see you next week, Wednesday at 2:15 p.m. Bye-bye.
Thank you for having me, Dr. Lola.
Oh, it was a pleasure. Thank you for being here.